Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Longstrugs.
Well, good morning and thanks for joining us here on this Monday morning. I'm Ryan Kalei Suji, joined by Yunji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. Great to see so many already of you logging in here, starting your week off with us as we begin this week, speaking with Governor David Ige.
That's right. Governor David Ige is joining us live from the Capitol. Good morning, Governor. Thanks for being here.
Thanks, Yunji. Thanks, Ryan. Thank you so much for giving me this opportunity.
Well, we have a lot to talk about, as always. I want to start with COVID because the numbers are still relatively high when you look at the percent positivity. And yet, when you look around, there is still sort of a mix of indoor masking and non-masking. How are you feeling about where we are right now as a state in terms of COVID?
Yes, Yunji, we still have a lot of COVID virus in our community. For the first time last week in 10 weeks, we actually saw the overall number of COVID cases decrease very slightly. So, we believe we're plateauing, which is a good sign. But the Oahu and Maui are at high transmission levels, or orange, and Kauai and Hawaii Island are at medium transmission levels. So, I think we all know what works, and we all need to be smart about what we do. Wear a mask if you're going into crowds or gatherings of large size. I recommend to people that they wear masks indoors. It does help prevent you from getting COVID. We are seeing a slight increase in the number of cases in the hospital, but it's nowhere near what we saw in the Delta surge. And so, we continue to monitor that. It's a concern, but it hasn't prompted us to take any action at this point in time.
And your message maybe right now regarding masks. We've talked to some of the other mayors in the various counties who've urged people to wear masks indoors, although there has not been any set regulations or any mandates that have been put in place regarding masks. But what is your message to not only locals, but visitors regarding mask wearing?
Yeah, certainly, Ryan. I strongly encourage and recommend that people wear masks indoors. I think it does help reduce the spread of COVID-19, and we do know that it works. People need to get boosted and up to date. If you're eligible for a vaccine, it really does reduce the severity of the illness should you get COVID. And we know what actions work. If you get symptoms, you should stay home and test yourself. I know that many who are fully boosted got infected with COVID, and they said it was not anything more than a typical cold. But I think it's really important that people remember that they are infectious, even if it's mild symptoms. So I think people need to recalibrate about that, especially those who are vaccinated. Even cold symptoms may mean you have COVID. You ought to do your at-home test to confirm. If you are positive, then isolate. All of those things work to reduce the spread of COVID.
On the vaccination front, for those of us who have children under 5, exciting times ahead. We are expecting that the FDA is going to be approving the vaccinations for those kids who are 6 months to 5 years old, who so far have not been eligible for vaccinations. What is the state's role in rolling that out? I know the state was very active when vaccines came out for all the other populations. Is this something that the state is involved in? Does this go to local providers? How is this going to work?
Yeah, certainly, Yunji. We continue to be involved with that. In fact, last week on the call with the White House, both Governor Baker from Massachusetts and I had asked specifically about vaccinations for the younger children. As you know, most pharmacies can only administer vaccines to those 3 and older. And so certainly if you have a young child less than 3, the primary source for getting vaccinations would be through your pediatrician. And, I certainly would encourage you to talk to your pediatrician ahead of approval and really ask if they'll be providing the vaccines in their office, or, make arrangements to get your child vaccinated.
I wonder if you can share a little bit more about your conversations with the White House and the other governors about what they're experiencing. And also, has there been any calls by maybe any of the other states or on the local to the federal level about more additional support that's needed at the state level? Maybe whether it be regarding more tests being available to the states, more funding for those types of services. What are the other discussions that are happening with the governors and the White House?
Ryan, there definitely is concern about the fact that the Congress has not appropriated additional funds to fight COVID. We do know that the federal government has really accelerated expansion of production of the therapeutic treatments. We know that the monoclonal antibody treatments as well as the oral antivirals have really been spurred by federal government committing to purchase large doses and then spreading it to all of the communities. We continue to have good supply of treatments as well as vaccines, but we do anticipate, and the White House has informed us that once we run out of the funds that have already been appropriated, then we are back to business as usual, which means that you would have to seek reimbursements from your health insurers. The treatments and the vaccines won't be as readily available as they are today.
When do you anticipate that happening, and what is your concern once we do hit that threshold?
I certainly, Yunji, would encourage, and I ordered my self-test at home. I would encourage everyone to do that. The federal government is still offering free at-home tests, and that really allows you to have peace of mind. If someone tells you that they have COVID, you can begin to test yourself, and the recommendation is to test yourself a couple of times if you had direct contact or prolonged exposure to someone who becomes COVID positive. So, I think that those are the kinds of things that make a lot of sense. We know what works, and we just need to be able to implement. I certainly would encourage people to get vaccinated and boosted if they're eligible. If funding for vaccinations dry up, then there'll probably be less clinics. There'll be less opportunities to get vaccinated. And, it might be harder to get treatment, or you might have to seek reimbursement for some of the treatments once the federal aid expires.
We know that the case counts, are continuing to go up, and while we aren't seeing the types of numbers in the hospitals that we are, there's still a lot of people in the community who are sick and infected, and it's really reflecting on our overall workforce and our ability for people to be able to continue to operate with so many people calling in sick, spending time in isolation, and this also includes our nurses and those in the medical facility. Are you at all worried about being short-staffed, not only on the medical front, but any of those essential core services because of the rising numbers and people having to stay at home?
Yeah, Ryan, that is the biggest concern that I hear from all of the chief medical officers at our major hospital facilities. They are seeing increased healthcare professionals become infected with the virus, and then certainly they are not able to provide services for a period of time. So that number is increasing, although it's not anywhere close to what we saw at the end of the year last year and the early part of this year. We are working with all of the hospitals. We are working to get people licensed should they need additional nurses or doctors. And so it is a big concern, Ryan, but it's not prohibiting people from getting health services that they need right now.
I want to move on. There are some questions in the comments about the bail reform bill, which has gotten a lot of press in recent weeks. There are a growing number of people, including the 4 county mayors, along with Honolulu prosecutor Steve Alm, who have called for you to veto this measure. Have you made a decision on that?
Yeah, thanks, Yanji. I haven't made a decision on that as yet. I continue to meet with the mayors. I've spoken, I think, with all the mayors at this point about their concerns on the bail reform. We continue to look at testimony provided and comments provided to me. And, I do expect to be making a decision in the next 2 weeks.
Have you spoken with anyone on the leadership side of the House or the Senate who actually pushed this bill through about some of the concerns that people are now raising? I know that there has been some feedback from those in the legislature who say they wish the mayors had spoken up sooner. But what are the thoughts from the majority leadership that you're hearing from about this bill?
I mean, I do think, and I've spoken with legislative leaders that said that, there was a lot of discussion and a lot of time spent in hearings on the bail reform measure. Certainly, they do hear the concerns in the community. And as you had mentioned, the introducers of the bill actually have reached out to me and just let me know that they believe that, and they are asking me to veto the measure. So, at the same time, other legislators continue to contact me to say that, they were involved. They think that it's an important step forward. And so, it is about trying to understand all of the dynamics on the specifics of the proposed legislation, and then really trying to determine whether it's really in the state's best interest.
I want to ask you about Red Hill because we haven't talked about that with you for some time now. Can you tell us about your interactions with the Navy up until this point and how you feel the process is going when it comes to defueling the tanks?
Yeah, thanks for that question, Yanji. I do think that the communications has been improved tremendously, since the initial lawsuit was filed. And as you know, they've withdrawn their complaint, and we are moving forward. They've committed to defueling the tanks as soon as possible, and then really working toward decommissioning. So, we did receive the independent assessment of the Red Hill operations, and we certainly see that there are many concerns identified just in terms of the physical facilities. They've suggested some improvements that need to be made in order to safely defuel. And they've certainly identified training and lack of training as a big area of concern. So, we continue to review the report. It's 800 plus pages. The feedback I get from our experts in the Department of Health is it does seem to be very thorough. They seem to have taken a real straightforward, independent assessment of the current situation. And, we will continue to have discussions with the Navy about the recommendations of the report and then how best to implement it as quickly as possible. I mean, I think I did have a chance to speak with Secretary of the Navy over the weekend, Carlos Del Toro. He is committed to doing the right thing. He acknowledges that in the past, maybe there has been disagreement about what we should be doing with Red Hill. He assured me that they are committed to defueling. They're committed to doing it in a safe way that doesn't put the aquifer at further risk. And he wants to do it as quickly as possible. He does know that the Navy lost trust of the people of Hawaii, and he's committed to restoring that trust one day at a time, one action at a time.
Is there any indication of what that timeline realistically looks at when that process begins for the defueling and just the shutdown of the facility?
Yeah, Ryan, there's very specific recommendations made in that independent assessment. Our people are having discussions with the Navy, trying to prioritize the most important ones, and then trying to work to develop how much that would cost, and then what would make the most sense in terms of implementing it. We don't want to rush it because we don't want to put the aquifer at risk. but we do want to defuel as quickly as is safe. And I think that that's the emphasis right now.
You know, the Navy has been issued a violation notice for overpumping its Waiava shaft. This is at a time when us residents are being called on to conserve at least by 10%, and we know that state agencies are trying to comply with that as well. So what's your reaction to that overpumping? And also, the fine for that is $5,000 a day, which for an individual would be significant, but for an entity like the Navy may not make much of an impact. Do you think that there should be a stiffer penalty or another way for the Navy to be forced to comply with, water limitations?
Well, Yunji, we do know that water is essential for those living within that Navy service area. And so we understand and we know that providing water to all of those residents and those working in Hickam and Pearl Harbor is really, really important. I think that they acknowledge that they are overpumping, and the Commission on Water Resource Management just wants to have a meeting with the Navy to talk about what they're doing to increase water availability elsewhere in their system. And I think most importantly, they want to derive a plan that will get them back to pumping water at the allowable rates, or requiring them to apply for increased water usage if that's necessary. So I think the main thing is we want to make sure that they're aware that we have limited water supply on Oahu, and we want to work with them to ensure that everyone on Oahu has access to clean water when they need it.
We're getting a lot of comments here in the comment section about tourism and over tourism. Wanted to get your thoughts as we are in the middle or the beginning of this busy summer months. We're seeing the number of tourists coming to our islands. In fact, take a look at this. This is a photo from the airport just last week outside of TSA. Long lines extending out to the curb yard area right in front of the Hawaiian Airlines terminal, just with the amount of people that are visiting the islands. And again, this does not include Japanese visitors or visitors from the Asian market, really. What are your thoughts about the state's ability to handle the amount of tourists that are coming to Hawaii? We could see record-breaking numbers this year, and just the overall preparedness of these facilities, and just the ability for us to welcome all these guests.
Yeah, Ryan, as we've had reduced numbers of visitors arriving here for the last 2 years, and certainly we are seeing increased demand. Most of that is coming from North America. We still are down significantly in terms of international arrivals from Japan, South Korea, Australia. And so we're working with TSA. They know, as you know, we've opened that brand new terminal on the Ewa side of the airport. We are working with TSA to make adjustments to the screening where it's occurring, trying to look at the bottlenecks in the system to try to reduce wait times throughout the terminals. So, we hope to get better. Part of that is everyone is having trouble staffing positions. And so I think as we return back to normal travel levels, we'll continue to emphasize and work with TSA to increase staffing, reassign some of the screening positions, and hopefully get to better flow of visitors through the terminal. As you had noted, I think one of the challenges in the Hawaiian Airlines area is that, they have the check-in for both the Trans-Pacific North America travel in the same area as the inter-island travel. And so it just becomes a very, very, very busy place, especially during the peak hours.
Well, one thing that strikes me about that photograph in particular is that very few people are wearing a mask, and they're all scrunched up together. And we're talking about people coming from not just different islands or different communities here in Hawaii, but from really all over the country, where the COVID rates are all over the map. What are your thoughts about, I see a lot of comments as well that people are worried about tourists coming to the islands and what they might be bringing with them when it comes to COVID.
Yes, Yanji, we continue to monitor that. We don't see a whole lot of COVID cases uh, associated with travel, or at least trans-Pacific travel. We do know that when our residents travel, they can get infected and they can come back sick. And so we continue to remind people that they can take actions to protect themselves. I definitely wear a mask. Actually, I wear a double mask when I go through the airport now. And whenever I'm indoors, we are informing people that I meet with. If it's a face-to-face meeting, we inform them that mask will be required when meeting. We've transitioned to virtual meetings again as well. So I think we all know what we can do to reduce the spread of COVID, and we all need to make smart choices. Wear your mask. If you get symptoms, even if it's mild, especially if you're vaccinated, you need to isolate and do an at-home test so you know whether you have COVID or not. And I just want to remind people that the oral antiviral medicines today can really help keep you healthy and reduce the impact of getting COVID. And so if you have symptoms, even mild, test yourself to make sure whether it is or isn't COVID. If it is COVID, you should talk to your doctor about getting these new antiviral treatments. They really make a difference.
Beyond just, of course, the airports, there are other tourist attractions that draw a lot of people that we, could see just an overall spike in attendance and the impact that it will have to just certain areas. There has also been moves by the state with places like Diamond Head to have reservations and fees in place at certain locations. Do you anticipate seeing any more of that or adding any more of those types of systems to other attractions? And if so, what other attractions and areas of the islands could that possibly include?
Yeah, Ryan, the big pivot that the Hawaii Tourism Authority is making is moving to this destination management action plan. Haiena on the North Shore of Kauai was kind of the first models, but we are beginning to implement the permitting process for out-of-state people wanting to visit these areas. We implemented the new permitting system for Diamond Head and hiking up Diamond Head. There's a permitting system on the road to Hana. We do anticipate, the destination management action plans have been developed for every county in the state. It identifies the high impact attractions in each county, and stakeholders have prioritized those destinations, and we are definitely working to get funding from the legislature so we can implement more of these permitting systems to manage the flow of visitors all across the state. That's one of the reasons we've been pushing for more consistent funding for HTA. We haven't been able to get that yet, but I think it's really important. If we, I think we all agree that we need to pivot and manage those who are coming. And having access to resources so we can implement these programs as soon as practical is really important to make sure that the public sees the government responding to their concerns and sees actions and how we can manage the numbers of visitors coming.
On that pivot, Heidi has a question here. She says, with the changes to HTA's marketing agents, how will we see a balance in over-tourism and quality of life for residents? Asking about education. HTA made a big decision to change that contract. Just interested to get your thoughts on that change and what you're anticipating from the new agency.
Yes, sure, Yanji. I would say this, and I did have the opportunity to travel to Japan and meet with all of our partners. I can tell you 100% compliance. Every airline, every tour company, every partner involved with tourism talked about Malama Hawaii, talked about things that they're doing to have videos in flight, to inform those who are interested in traveling to Hawaii about our Malama Hawaii programs. They're very interested in supporting Hawaii's push for clean, renewable energy, and they are interested in partnering on programs to support that. So I saw just a 100% turnaround in all of our travel partners from Japan. We anticipate and believe that the same could happen in the North America area. And so, I'm excited. I'm hoping that we can get through the procurement process and the contracts can be awarded appropriately. I'm excited about the new opportunities that can become available. In my discussions with the domestic airlines, they all understand why it's important to pivot to more sustainable travel from the mainland, and they have promised to help us work to inform the travelers, as well as work with our communities to alleviate most of the friction points that we can see here in our communities.
Well, as we wrap up our conversation this morning and our conversations with you, being that you only have a few more months in office, one of the things that we like to do is try to end on some reflection questions. And so the question that I have for you this week is looking back at all the things that you've experienced over the past 8 years, what was perhaps your most memorable experience, something that you will take away as one of your more favorite moments or highlighted moments during your 8 years as governor?
Ryan, I was just reminded by the First Lady over the weekend. This was our last King Kamehameha Day celebration. And the governor's office did not participate in the lei draping ceremonies in the past. And it was one of the things that the First Lady really thought was a good way to bring volunteers and state employees together to sew a lei. We put together a volunteer committee, and I was proud to display a 30-foot long lei that draped on the King Kamehameha Day statue. So I think that that's one of the things I'll remember the most. Those kinds of things that we did to express our appreciation to many of the people here in the islands. I definitely learned a lot about Hawaiian history and culture and traditions. And it is traditions like the King Kamehameha Day celebration that, reminds us about King Kamehameha's contributions to our community. And you can really see the resurgence and pride in the Hawaiian people and all of the state in recognizing this truly outstanding monarch.
Governor David Ige, thank you so much for sharing your perspective with us this morning. We always love having you on, so thanks for starting your week here.
Aloha.
Well, we started off our conversation with the governor talking about COVID-19 and the current rates. He does say that he is concerned about the positivity rate that we are seeing. However, did note that for those folks who are vaccinated and boosted, the infection can be relatively mild. And so he's encouraging folks who are eligible to go out there and get that booster or get vaccinated if you have not already. He also did issue somewhat of a warning about the expiration or limits of federal funding, saying that these vaccinations might not be free forever. The testing that you can get in the mail from the federal government may run out. And so order those tests if you have not already and get the vaccination while you can and not have to worry about reimbursements and the like.
Yeah, and also, of course, just continue to urge people to wear masks when indoors, although there is no sign that there will be an implementation of a mask mandate that is reinstated into the state or at state facilities. The governor clearly saying that he's encouraging residents to wear a mask, especially when indoors, but he's also touting the achievements and the things that have happened on the medical front that have accelerated the process. Of course, the medication that is now available, the antiviral treatments that are made available to those who do test positive, saying that that has become a game changer and that has helped to keep this virus under check, and also saying that that is something that people will continue to look at as we see tourism continue to grow here in the islands with more and more people coming to Hawaii, that is, of course, another weapon that the state has in their arsenal to help combat against COVID-19.
Yeah, we are expecting a very busy travel season. We already see it in that picture that you showed us with the lines at the airports, people packed in. He says he's encouraging TSA to, perhaps expand coverage at the airports to make more kiosks available so that those lines can move a little bit more quickly, but they are limited in infrastructure in what they are able to do. He did talk about tourism briefly and some of the changes that the HTA has decided to make when it comes to awarding contracts for marketing, saying that, of course, that's still, in process, but something that he thinks could yield good results for residents. And then we talked a little bit about Red Hill.
That's right, giving us an update on where we are there, saying that they continue to work with the Navy and that the conversations with the military officials that are helping spearhead this have been going well, that he has noticed a significant difference in their tone as well as their action, and he hopes that that will continue on as they move forward through this progression plan of how to defuel this facility. And finally, we also heard about his stance right now on that veto list, really specifically towards that bail bond bill that has caused a lot of thoughts and a lot of conversation in the community, with many calling for the governor to veto. He has not yet decided on what he's doing, saying that he continues to have conversations with those who support the measure as well as those who oppose it, which include the 4 county mayors. So we'll have to wait to see over the next few weeks what the governor decides to do with that bill and the other bills that he intends to veto.
And before we get to what we're heading up on Wednesday, we want to give a little shout out to our own Ryan Calais. If you could lean to the side. This is Ryan. Over the weekend, went to San Francisco and won an Emmy for his work with RKT Media, which is his other job. We just want to give Ryan a big congratulations and say, what a wonderful win for you and for the state of Hawaii overall.
Thank you very much. It was kind of a shock, but glad to be back home. Thank you.
Right. Good to see that. Sorry, my tech skills aren't Ryan's skills, obviously, but we wanted to showcase that very, very big win and wish him congratulations. Looking forward to Wednesday, we're going to be talking to the leaders of a new group called Housing Hawaii's Future. They're an advocacy group for young people trying to deal with the cost of living here in Hawaii, specifically looking at affordable housing, just how difficult it is for a young person to buy a home and what that is doing to the state of our state. So we'll be talking to those folks on Wednesday. We do hope to see you right back here at 10:30 on Wednesday.
Aloha, we'll see you then.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.